Is eating behaviors in relation to public health outcomes, specifically within the context of social norms in urban environments. And so if we look at urban eating behavior, we see this in the increased options for quick and easy food. And what this has done, so as we have options for convenience food, we have adopted behaviors of convenience eating. And so we're eating while engaged with other activities, while on the go, driving, getting work done on the computer or in front of the TV. We often eat while engaged with other activities and behaviors. And this lack of a dedicated meal space within daily living. So we're not talking about like social gatherings or eating out with friends in celebrations or that sort of thing. We're talking about just the daily lifestyle of work and getting things done, and how mealtime fits within that or doesn't fit within that. So how this is all relevant to public health is that diet and exercise is commonly coded as a factor to health conditions such as cardiovascular disease, obesity, etc. But what hasn't been sufficiently studied is the eating behavior part of diet, or furthermore, that diet is just an aspect of eating behavior, and that it would be more relevant to study eating behaviors as a whole rather than just diet when we're examining the act of eating within these diseases. And what got me interested in this topic is the observation that even food-aware individuals or quote-unquote healthy eaters often experience food sensitivities and intolerances, and you can see this in the whole gluten-free surge that's been going on. And so even individuals who might eat healthy are still experiencing digestive disorders or other health outcomes that are potentially negative and contribute to an overall burden of disease. And so what the following research that I'm going to present to you implies is that it is not just what individuals eat, it is the way in which individuals eat that is associated with public health outcomes. And so the question of interest is, how is the space in which to eat within urban environments related to public health outcomes? And to examine this question, we are going to first identify the current food paradigm and how time use is related to that, changes in time spent on eating related activities. We're going to examine associated cultural values with convenience food and how that has produced norms of behavior. And from there, we're going to examine potential negative health implications around food consumption and the lack of time spent on the actual act of consuming food. So in 2013, Smith and his colleagues did a study on comparative time analysis on eating practices from the 1970s to the early 2000s. And what they found was a general decline in time spent on eating-related activities. This decline seemed to die off in in 1990, it leveled out, and so there was an established new norm of time spent eating on eating-related activities. And so what they found is that on average, individuals spend about an hour cooking a day and 20 minutes per meal. And so we see that there is just a reduced space for meals within daily lives. People are eating out more, but but it's about on par with eating at home. But even while they're eating at home, we do see that this is a quick and easy meal at home. And if you look at the time spent daily on daily eating activities. What they also found was that just under half the individuals might spend no time on a given day on food preparation. And so what Botanicki and Mattis studied in 2010 was the actual associated values with this. And their data suggests that individuals who use convenience food um, view it as a sort of contributor to power, ability to get other things done, and in general self-enhancement. So we think of a reduced time spent on eating as a self-enhancing quality of food because we now have time freed up to spend on other things. But what's wrong with this lessening of time spent eating? So Zhu and Hollis looked at eating behaviors of obese and overweight individuals in comparison with normal weight individuals, and they found that overweight individuals spent significantly less time chewing than normal weight individuals. And so we see that this like quickness in chewing is associated with obesity. But what Koik and colleagues in 2013 examined was just the general health effects of insufficient chewing, and specifically individuals with malaculation or an impaired bite. And so individuals who couldn't chew their food properly did experience digestive strain overall and a decrease in digestive function. And so from these last two studies, we can see that there is implications of a lack of time spent eating, chewing, the actual act of food consumption. What the first two studies were missing as far as time use and values was the collection of data on the health status of these individuals. So these former studies did not take into consideration the health of the individuals, and these latter two studies did not take into consideration general eating patterns. But if you look at the conjunction of these trends, we can form an idea that the reduced space in which to eat may be indicative of negative health outcomes. And so to look at all this research, we can frame it from a sociologist's perspective. Henry Lefebvre, he was famous for his critiques on capitalist commands of space, and he said that space was socially produced, and we've seen that in our past studies on social values, that they have created norms which has lent itself to changes in space around eating. But what we also can see from Lefebvre is that this whole capitalistic space concept, like eating out or being constantly engaged in activities and like working, all those sort of things benefit an economy. And so we're sort of adhering to productivity and participation within the public sphere, and not spending as much time cooking, preparing food at home, or even growing our own food, because that might be seen as a potentially socially deviant behavior because it does not provide funds for capitalistic space. But anyways, that's a framework in which to view the situation. The implications of all this research are that the lack of space in which to eat is a potential effect modifier to diet in relation to factors of disease. And we've seen that potentially eating behaviors would be a better focus of study than just diet when we're looking at chronic diseases. So my recommendations from this research is that eating behavior, or the way in which individuals engage with food, should be taken into consideration as a factor associated with public health outcomes, and that further clinical studies should be done on general eating behaviors and individuals with any sort of disease, but specifically digestive disorders or food intolerances, gastrointestinal issues, or in diabetes. Thank you so much for listening to this presentation. I hope you enjoyed yourself and have a good day.